Over 2,000 women are diagnosed with spinal cord injury each year in the United States. Because they represent only about 20% of all such injuries, researchers have been slow to examine their unique health and wellness issues. Dr. Amy Jackson is among a growing number of respected researchers studying these issues.
Women with spinal cord injury or disease face a number of unique health care needs related to pregnancy and delivery. Although the majority of women who are newly injured are of childbearing age, they often receive little education on sexual issues during their rehabilitation. Without the proper education, many women with spinal cord injury may make uninformed choices on whether or not to become pregnant. Furthermore, they may have difficulty managing their pregnancy. In addition, many physicians and other healthcare providers are unaware of the facts about reproductive issues for women with spinal cord injury. As a result, some clinicians may discourage women with spinal cord injury to become pregnant or recommend an unnecessary, undesired therapeutic abortion if a woman does become pregnant. This video is intended to educate both women with spinal cord injury and healthcare professionals on issues of pregnancy and delivery. Although there are risks for medical complications, those risks can be reduced with proper prenatal care and adequate planning for the different stages of pregnancy and delivery.
Facts are simple. Women can and do have children after injury. They share the same parental responsibilities of all women. They must know how their body will change and how to best avoid complications during pregnancy. And they need birth control if they don't want to become pregnant. Meet Shirley, Evora, Melissa, and Carolyn. They are true experts on pregnancy after injury. They joined Dr. Jackson to discuss their experiences.
I really want to thank all of the women here today for coming and giving your experiences. Did friends, family members, or even doctors try to discourage you from having a baby?
Well, I can say that mine was such a shock that they couldn't discourage me because I was already pregnant. You know, I didn't know I could have a child, but I had some people that didn't think that I should carry the child, and they thought I should abort, and I thought that was really narrow-minded, you know.
Mm-hmm.
But
unfortunately, there is an increased abortion rate, elective abortion rate in women with spinal cord injury. Yes,
wow.
some studies have shown that. So it is important to realize that you have a right to carry your child and should not be prone to listening to what other people say.
Yeah, a lot of my family had some fear about it, but they weren't really, they didn't discourage that I carried the child.
I think that's how it was with me. I think mostly my mother was concerned and worried about it, but I think that even if I hadn't been a spinal cord injury, that she would have been worried. But mostly, like my husband's family and my friends and people I work with and all, everybody was always saying, when are you going to have a baby? When are you going to have a baby? You know, and so it was like, to them, it was a natural thing.
Right.
I had people to tell me, you're just getting used to the chair. Why would you want to carry the baby? You need time to heal yourself. And I didn't feel that that was right because they was looking at me as being in a chair. And I know that there's plenty of people that are up and have babies. And they was just looking at me being in a chair. They never did. And I think that it's very wrong for them to say things like that.
I think that people have different ideas about a person in a wheelchair that has a baby. Maybe they think we'll be sick or have more problems. I wasn't discouraged about having a baby because no one knew I was trying to get pregnant other than, you know, my doctors who were encouraging me. But my family didn't know, just my husband and I. We wanted it to be a big surprise. And I never expected that maybe someone that was the closest to me, like my dad, would be the most concerned. And I think it was directly because of the spinal cord injury, and he felt like I would have special problems. And when he saw that things went well, his whole attitude changed. And then when I had my second child, he didn't have any concerns. So it just, you know, he just needed to go through a period where he could learn and adjust.
I have a lot of people that come to me in clinic asking if they can have children and concerned about it. And my approach is that every woman has to decide when and to have a child, and if to have a child. But being in a wheelchair is not a reason to keep you from having a child.
Women who want to have children should get an obstetric evaluation and counseling before conceiving. Obstetricians and anesthesiologists providing such evaluations should be well informed on the many unique healthcare issues of women with spinal cord injury. For example, many prescribed medications, along with many over-the-counter medications normally used by women with spinal cord injury, can cause or add to complications during pregnancy. Some medications can also have an adverse effect on fetal growth. Therefore, it's essential that all treatment options be evaluated throughout pregnancy. High risk is a term that describes an increased chance for complications during pregnancy. Women with spinal cord injury may be considered to have high-risk pregnancies, but pregnancy doesn't have to be avoided. It simply means that precautions need to be taken to prevent and treat complications. Doctors with limited experience in pregnancy after spinal cord injury might choose a team approach. They can talk with an experienced physiatrist as well as other rehabilitation specialists to better plan for the medical, psychological, and social issues women may face.
During pregnancy, each trimester brings the possibility of new medical challenges for women with spinal cord injury. It is very important to first be aware of the potential problems that may occur. Also, women with spinal cord injury and their physicians should work together to develop a plan to prevent medical complications if possible. Finally, they should also be aware of ways to manage problems if they occur.
During the first trimester, women with spinal cord injury primarily experience those natural changes that occur during all pregnancies. These usually go away in time. Some women may start to notice changes in their bowel program as early as the first trimester. It may be necessary to empty the bowels more frequently or take a stool softener, but only if prescribed by a doctor. For women with spinal cord injury, the potential for complications increases during the second trimester. Meet Suzanne. She and her husband, Chris, adopted Natalie after attempts to become pregnant were unsuccessful. 2 years later, Suzanne became pregnant, and now, into her second trimester, she's sharing her experiences.
First of all, it was a huge shock that we got pregnant in the first place, because we had pretty much put it out of our minds that we could even get pregnant. When we first started trying years ago, we read a lot of articles and we tried to do a lot of talking to specialists and other people. One lady in particular that I contacted in Indiana, and she she had done a whole history and kept a log of her pregnancy, like a journal. She talked about the dysreflexia, the sweating, and the compromised breathing and things like that. So I kind of knew that those were risks. And also when we talked to doctors here and in Birmingham, they explained the different risk factors. The doctors here seemed to be so concerned about the respiratory and things like that they were not in favor of even trying. But on the other hand, Dr. Jackson was very positive, and she was saying there's ways to mitigate certain risks, and you can plan ahead and you can look for warning signs. And so she was very, willing to make suggestions on what we could do to avoid problems.
Suzanne and her obstetrician are taking a team approach to managing her pregnancy. Dr. Jackson is assisting on medical issues, and other rehabilitation specialists are helping Suzanne manage other issues, such as weight gain.
Weight gain is one of the major concerns for women with spinal cord injury. This change often interferes with a woman's ability to perform everyday activities. For example, many women have difficulty transferring or pushing their wheelchair, especially during the later months of pregnancy. There may also be an increase in fatigue because some women are unable to perform daily activities with the same ease as they did before their pregnancy. The solution to a specific problem will depend on the individual woman. Some women may reduce the number of times they transfer if that becomes a problem. Some women may want to rent or purchase a power wheelchair if they have trouble pushing their manual wheelchair. It may also be necessary for some to get assistance from others or to find a new way to accomplish the everyday task.
As the fetus grows, there's also increased pressure on internal organs. For example, it's common for women to experience increased weight on the bladder, which can be a problem for bladder management. Shirley, Evora, Melissa, and Carolyn talk with Dr. Jackson about their experiences with complications.
Okay, let's talk a little bit about your experiences during your pregnancy, the pregnancy itself. Were there any particular complications that y'all had more frequently than you think able-bodied women, or more frequently than you had before? For instance, I think, Shirley, you had mentioned to me one time about urinary tract infections.
My doctor was very concerned about UTIs since I, had UTIs, and that might cause me to go into labor early. And she actually went ahead and put me on an antibiotic from the very beginning, a low-dose antibiotic every day to help try to prevent UTIs. And it did help, and it helped me get through both of my pregnancies. I did that. And I luckily, did not develop a UTI while I was pregnant.
How many of you had a change in your bladder management?
I did toward the end. I had to go to a Foley because
It was towards the end,
it was just
about the 5th, 6th month that I did that.
I didn't have to go to a Foley, but I had to calf myself more often, but I didn't have the Foley in. I just noticed that I would have to go, I trained my bladder on the 6 hours, but I was going within 3 hours before I had to. So I noticed a change in my bladder.
And I wore a Foley during my entire pregnancy, or pregnancies, and I had to go empty the bag a lot more often. It was very noticeable. So I would think that would be a big concern with someone who doesn't wear a Foley all the time.
Did you have any problems with the indwelling Foley?
Toward the end, the Foley would, I guess, due to the pressure from the baby, would tend to come out real easy, and I would have to change it more frequently.
Right. And my point of asking that question is that there are changes going both ways. Some people will continue to perform intermittent catheterization but still have more problems, more leakage. It doesn't necessarily mean that putting in an indwelling catheter is the answer for that, but on some occasions it is. So it's a dynamic process throughout your pregnancies to assess your bladder management and what's right for the individual. There's not one thing for everybody.
And I wanted to do it for convenience, too.
Women with spinal cord injury are more likely to have urinary tract infections during pregnancy. However, it's a good idea for doctors to get a urine sample before treating an infection. This helps to identify the most safe and effective antibiotic to treat the infection. Plus, it can confirm that there's no other health problem. Skin breakdown is another concern, and women who are pregnant are also vulnerable for pressure sores. Again, Shirley, Melissa, Carolyn, and Devora discuss their experiences with Dr. Jackson.
What about skin problems during pregnancy? Did anybody have any problems? I know that, Devora, you had mentioned something earlier.
I began to develop a pressure sore when I was about maybe 4 months. And the more the baby was growing, it was pushing down on my bottom by me sitting in a chair. So I developed a pressure sore.
Anybody else have skin problems?
I got lucky there. I was real fortunate.
I didn't either. I felt like my skin was better during the pregnancy than it had ever been. And I just, in my mind, attributed that to the vitamins, the prenatal vitamins. I started taking those real early, I think when I was just 4 weeks or 6 weeks, 4 to 6 weeks pregnant. And my skin and my hair was just wonderful.
I think everybody says that. Well, but this is a problem. There are an increased incidence of pressure sores during pregnancy, not just from the heaviness of the baby, but the changes in your center of gravity. It changes the pressure points on your wheelchair. If you are prone to that, it's important to get that monitored. But continuously surveilling your your skin, which is what you did. You said you caught it pretty early. That's important. Getting more assistance with transfers is helpful too.
I was real surprised that I didn't too, because I was real worried about it, because I gained 40 pounds.
Obstetricians should include skin inspections with prenatal examinations beginning in the 2nd trimester. Women should take special care to prevent abrasions when doing transfers. They need to check their skin more often and get help with pressure reliefs and skin checks if needed. They need to watch for posture changes while sitting in a wheelchair. To prevent problems, it helps to increase the number of pressure reliefs and work with a physical therapist to change seating position. By the 3rd trimester, pressure on the diaphragm normally decreases lung capacity. However, women with cervical and thoracic injuries can have an added decrease in lung capacity. They normally have a decrease in lung expansion after injury, which makes it difficult for them to take deep breaths. As a result, they have an increased risk for respiratory complications such as pneumonia. A higher level of injury results in a greater decrease in lung capacity. The best way to prevent serious respiratory problems is through proper positioning and added rest. Women who normally wear abdominal binders to improve diaphragm function may need to loosen the binder or not wear one during pregnancy. It may be necessary to monitor the ventilatory function of some women with cervical injuries, and some may need ventilatory assistance. Pressure from the growing fetus can also hinder blood flow in the lower extremities, so it's common for women to have swelling in their legs and feet. Some women wear circulation-promoting hose, get extra rest, and do passive range of motion exercises to reduce swelling. Women with a history of blood clots may need medication to help prevent clots from forming. Suzanne is now in her 3rd trimester. She finds some complications easier to manage than others.
There's a few things I expected to have major complications with that I really haven't experienced any problems with, and one is respiratory. Although I still labor to breathe some, that's sort of normal with me anyway, but the baby is not obstructing my diaphragm in any way, which is a relief to know that, and she's low enough I think that it won't be a problem from here on out. Actually positioning in my chair, although I'm a little slouched, I'm not really having balance problems or issues. As far as fatigue goes, I think just all the sweating issues and the nighttime positioning, which has been an issue in the last 4 to 6 weeks. I'm not getting a whole lot of sleep. I'm not getting restful sleep. So yeah, I'd say fatigue is an issue. And it's also hard for me to lay down during the day since I can't transfer myself. Another thing that I'm expected to be worse is the swelling in my legs and feet. And I'm trying to wear the compression hose as much as possible, but even the days where I don't wear them, they don't swell any more than they used to. As a result of all the sweating and dysreflexic conditions, I've had a problem with dehydration. Every morning I would say I'm pretty much dehydrated. I've actually had problems with passing out in the shower from just going from a laying to a sitting position and not having enough fluid. Although I try to drink as much as I can during the night, with the amount of sweat that's coming out during the night, I just can't seem to get to an even state. Plus I'm supposed to be doing extra fluid. But I would say that the dehydration from the sweating and the diarrhea has been a major problem and concern that I'm trying to stay on top of. Some of the things we've done to prepare for the delivery is, the first thing I did was I gathered a team of specialties, doctors that I thought would be critical. Urology, my #1 concern. So I've got my urologist from my original injury on my team. I had a pulmonary person just in case, since I had problems with pneumonia prior to this. Also have a neurologist that I met with just in case there's other neurological issues. And I'm also meeting with the anesthesiologist next week to talk about epidural and other medications they might need to give me hopefully during vaginal delivery as opposed to C-section. We've talked about inducing, because I don't want to go into labor on my own at home because of the fear of the dysreflexia and what could happen. So we're planning. We don't have a date, but we're going to go week to week. Another big help is that I've got family nearby. I've got my parents that live 6 miles away, so they're going to be a huge help. And right after the delivery, Chris's mother's going to come probably for a week or two, and then of course my parents are here. And he's actually been a big help in my care with all this hospitalization and everything else, and trying to help me get positioned at night. He's played a huge role and been very helpful in understanding and learning as we go.
Suzanne is a perfect example of how impossible it is to predict complications during pregnancy. Every woman is different. For example, some women experience an increase in muscle spasms during pregnancy, and some women have a decrease in muscle spasms. Some complications can occur during the first trimester and fade away in a short time. Other problems can continue throughout pregnancy and delivery.
Women with spinal cord injury and their physicians should also be aware of what to expect during labor and delivery. There should be a plan for managing essential issues. Obviously, the labor, delivery, and patient room should be fully accessible. Some women, particularly those with tetraplegia, may have problems recognizing labor pain. Women with injuries at levels T6 and above are likely to experience autonomic dysreflexia, which can be life-threatening if not managed properly. These are some of the issues that should be discussed well before the actual labor and delivery.
Women with spinal cord injury have a slightly higher preterm labor rate than commonly seen in the general population, but this fact may be the result of a lack of sensation and an inability to recognize contractions and labor pain. Women with level T10 injury and above are not likely to feel labor pain, although women with injuries below level T10 may experience uterine contractions. The feeling is usually different from able-bodied women. Therefore, many women report to the hospital in active or advanced stages of labor. Suzanne's pregnancy successfully ended with the birth of Amanda. Now, Suzanne joins Dr. Amy Jackson and the other mothers to discuss labor and delivery.
Let's talk about preparing, especially since we have somebody who just went through this recently, and then y'all can remember way back. But let's talk about how you prepared for labor and delivery.
I did go to labor and delivery class, and oddly enough, at first I didn't think I should, because I didn't think being with other able-bodied that we would be able to participate, but I was pleasantly surprised that we should go. Other than doing the exercises on the floor and things like that, the rest does pertain to me. So I'd advise anyone to go ahead and schedule birthing classes.
The instructor in my labor and delivery class was very helpful in getting information, especially to my doctor and to the nurses who would be involved. She worked with your office, Dr. Jackson, and got information about autonomic dysreflexia and other issues that I might have once I went into labor. But I found the classes to be very helpful also.
When I went to my classes, just what I had seen on TV and stuff, I thought they would have to get down on the floor and all that stuff, but nobody did. And we just sat around the table and we talked, and it was just getting a chance to talk to other people that were going through the same thing that we were going through.
What were your labor symptoms?
My stomach, there was just cramping. I felt the contractions over my whole stomach. The baby was just balled up. I mean, I was just so agitated that I couldn't lay down, I couldn't rest. It was like before. I knew I was in labor, and when I went to the hospital, I was in labor, and I was only 7 months at the time. And I was still hurting. I was crying. I was screaming. That pain was still there. I still felt that same pain that I had. It wasn't as much as it was if I was up, but I knew that it was something.
At the point when most women would be screaming, you know, I was still very comfortable. But my doctor identified my labor by putting me on the monitor every week and caught the initial contractions. But at that point, I didn't have any idea that I was in labor. I couldn't tell, and I thought that I would. I felt both of my children move and kick me, and you know, in the labor and delivery classes, they tell you what to look for, and I just thought, oh, I'll know when I'm in labor. That will not be an issue, but I certainly didn't.
Mine just really did literally hit me like a ton of bricks. I mean, we had just finished eating dinner. Bo got up to take the plates to the kitchen, and by the time he got in there, I was screaming. I mean,
With
just
pain?
just in my head.
Oh,
the
your
headache.
your headache. So
Real severe.
Your water hadn't broke. You didn't have abdominal pain. It was a severe
It was
headache.
the head.
And you knew then that something
bad was wrong, I thought. I mean, really.
So what did you do?
Call 911.
Did you think it was
And-
related to your labor?
I assumed so, yeah.
Okay.
I assumed that it was something related to the baby. And I just assumed maybe it was, you know, going to be something false, but this was the real McCoy. And it really was a painful headache. I mean, and too, when the paramedics got there and they took my vitals, I, you know, asked, I said, well, what's the blood pressure? And he said 180/102, and he said that it was nothing to worry about. And I couldn't see.
Did you later have abdominal or pains before you?
Just the head.
What about Carolyn?
I thought, well, I'm going to feel labor, I'm going to know it. And I didn't. Actually, they induced labor on me. And that morning, I was laying in the hospital bed, and they hadn't hooked the IV up or anything to start the drip or anything. And I had a contraction, had a labor pain. And I looked at the nurse, because I looked at the stuff like, okay, is this started? And she said, no, that was a real contraction. And I felt it, and it was painful, but not severe. But I think if I had been at home, you know, like doing my thing and stuff, that I may not have paid much attention to it. But then after that, that was the only one I had.
As you actually have delivery, the nervous system that's in control of those and makes you feel the pain are actually in the sacral region. So a lot of people may initially feel labor occur from the thoracic, lower thoracic nerves, but as labor progresses, then you don't feel it because of because those nerves are a different level.
At 34.5 weeks, he agreed to go ahead and induce me, and I think all things considered, that was the safest way to do it, just because of my dysreflexic condition. And really, all in all, the whole pregnancy, the delivery was the most relaxing, I guess, and the easiest and the most beautiful part. All the contractions during the day pushed the baby all the way down, and really it took like maybe 6 or 7 really hard contractions at the end. And he just kind of got her head and used the vacuum suction. And I would tell him when a contraction was coming, because I could pretty much tell just from the pressure and by the monitor, I guess. And she came out vaginally.
As a precaution, doctors might want to perform weekly cervical examinations after 28 weeks. Women with paraplegia can be instructed in uterine palpation to better detect labor. Women with higher levels of injury may need a home uterine contraction monitor. Some signs of labor may include feelings of fear and anxiety, changes in spasticity or breathing, backache, abdominal tightening, pelvic pressure, unusual feelings of pain, or autonomic dysreflexia, which has been documented during labor in women with levels of injury much lower than T6. Although some women might not need anesthesia due to a lack of sensation, a continuous epidural anesthesia is the most effective method of preventing autonomic dysreflexia during labor and delivery. Bowel and bladder management, urinary tract infection, skin care, muscle spasms, and DVT can also continue to be problems during delivery. So women and their doctors should be prepared to prevent or manage these problems. In delivery, there is a higher frequency in use of vacuum or forceps, and some evidence that women with spinal cord injury have an increased risk for blood pressure instability and abnormal bleeding prior to delivery. Plus, research shows between a 20 and 30% increase in cesarean sections for women with spinal cord injury. However, this increase may not be due to necessity. It may result from obstetricians being more comfortable performing C-sections. That percentage may decrease as doctors become more familiar with women with spinal cord injury. Research shows that outcomes of pregnancy after injury are favorable. There is, however, some evidence to suggest that women with spinal cord injury have an increased risk for excessive bleeding postpartum. Some evidence also suggests minor fetal and infant complication are possible. However, all of these problems require further investigation. Research shows that more and more women with spinal cord injury are becoming pregnant. They are managing their pregnancies, giving birth to beautiful babies, as do other women, and enjoying everything that being a mother has to offer.
It's worth all I went through to have a baby. It is a very big decision, but it's definitely worth it once you get your prize at the end. The delivery was just the most awesome, incredible thing I've ever experienced.
And motherhood is the greatest thing in the world. You never know you could love something so much until you see it. And I just really don't feel any different than anyone that's not in a chair.
I believe anyone that wants to become a mom should have that opportunity if it's possible. I feel like becoming a mom was one of the most wonderful things in my life.
I wouldn't change nothing. I love my daughter. No matter what other worries I had, when I looked into my baby's eyes, it just stopped it.
Now that I am a mother, it is awesome. It's wonderful.